We are going to explain about posology. Posology is a branch of medicine and science which deals with the dose or quantity that can be administered to a patient to get desired pharmacological actions. Let's see etymology of posology. The term posology originates from the Greek posos meaning how much and logos meaning study or discourse. Let's see definition of posology. Posology means doctrine of doses of medicine. The terminology of the dose is derived from the Greek word dosis, which means a giving the quantity of a drug or other therapeutic agent to be taken or applied all at a time or in fractional amounts within a stated period. Let's see posology in relation to homeopathy. A homeopathic dose means the particular preparation of a medicine used, the quantity and form of that preparation as well as the number of administrations of the medicine. In short, homeopathic dose includes potency, quantity, form and number of administrations of the medicine. So, the study of doctrine of these doses is known as posology. So, let's learn about the terms the dose and potency. The drug dose refers to specific quantity of a drug that is administered at one time or over a specific period. The term potency refers to the amount of drug needed to produce a specific effect of a given intensity. It reflects the drug's ability to elicit a response at particular concentration. Next, we will learn about selection of potency. A very well selected remedy may fail or even do injury because of wrong doses. The medicine may fail to produce any favorable effects in lower potencies in a case, but may show unexpected good results in higher potency. For example, ipecac in large doses cause nausea and vomiting, and in small doses under certain conditions it will cure the disease. So, selection of proper potency is another great difficult task for the physician after proper selection of the medicine. Susceptibility is the only guide for selection of potency. The phrase which is used for this purpose is more the susceptibility, higher the potency. Less the susceptibility, lower the potency. Let's learn about types of potencies. We have three types: low potencies, medium potencies and high potencies. Potencies below 30 are low potencies and potencies between 30 to 1 m are medium potencies and potencies above 1 m are considered as high potencies. Low potencies are organotropic, that is, they are specific to a particular organ. Medium potencies influence the function and higher potencies are for the sick people. Various factors contribute to assume the susceptibility of a patient. They are age, sex, habit and environment, constitution and temperament, nature and depth of the disease, structural changes, mental and physical reactions to environmental stimuli. If we consider age of a patient, children and young people require higher potencies because there is no wear and tear of organs and tissues. But in old days, susceptibility becomes gradually low due to wear and tear of organs as well as different degenerative changes. So, they generally require low or medium potencies. If we consider sex of the patient, females require medium potencies because they are less exposed to mental stress and strain, worries and anxieties. Males of irritable, sensitive nature having higher susceptibility require higher potencies. Next, habit and environment. Higher potencies are best adapted for the persons who are engaged in high intellectual work and mental work. Example, doctors, lawyers and ministers, etc. Persons who lead sedentary occupations, who sleep long time, and lower potencies are best adapted for the persons who are engaged in physical labor without much mental exertion, who sleeps little, whose food is coarse, and persons who are exposed to continual influence of drugs such as tobacco workers and dealers, distillers and tobacco traders, etc. The persons who are deaf and dumb also requires lower potencies. Next, coming to constitution and temperament of a patient. Higher potencies are best adapted for the persons who are very sensitive and of nervous sanguine and choleric temperament. Intellectual persons who are very quick to act and react. The persons who are very jealous and impulsive also requires higher potencies. And lower potencies, which are repeated at frequent doses, are best adapted for the persons who are very phlegmatic and sluggish, and those who possess great muscular power but who require a powerful stimulus to excite them. Lower potencies, but which are repeated at long intervals, are adapted for the persons who are very oversensitive and idiosyncratic. For oversensitive patients, they require very low potencies, that is 3rd to 30th potency, a single dose at a time with long intervals. For idiosyncratic patients, they generally have higher susceptibility, but they must not be given in such high potency. It is sufficient to inhale few globules of 30th potency only for few seconds. The dose may be repeated after 2 to 3 or even after 6 months if needed. Otherwise, these patients have no chance of cure. If we consider nature and depth of the disease, in case of acute diseases, no structural change is usually effective in such a case. So, susceptibility of the patient remains higher. So, they require repeated doses of higher potencies. In case of chronic diseases, we consider gross organic changes. Without gross organic changes, high potencies are curative, and with gross organic changes, low or medium potencies are required. In case of mental diseases, susceptibility is very high, but high potencies are contraindicated in such cases to start with because of the possibility of too violent aggravation. In case of difficult and incurable diseases, the patients with difficult and incurable diseases will avoid severe aggravation and get palliation of their symptoms. So, 50 millismol potency is best used for this purpose. Even the incurable case may turn into curable stage after the use of successive potencies in this case. Next, coming to stage of the disease. The disease process is manifested in 2 stages: dynamic pathology and organic pathology. Dynamic pathology denotes the stage from the very beginning of the disease till structural changes starts. During this period, only functional disturbances are reflected, so susceptibility of the patient is greatly higher. For this kind of chronic diseases, must be treated with higher potencies in single dose. On the other hand, organic pathology denotes the stage from the beginning of the structural changes up to end of the disease process. During this period, susceptibility to a disease is gradually decreased. As a result, the potency should be lower. Next, nature of the medicine. The nosed group of medicines should be administered in higher potencies for its true effect. Some medicines work best in lower potencies, such as Calcarea idatum in gout.
Types of doses: maximum dose, minimum dose, lethal or fatal dose, booster dose, physiological dose, fractional or refractive dose, and minimum lethal dose. Maximum dose: it is the maximum or largest possible quantity of medicine not harmful to human life which can be taken at a time by an individual. We know that in homeopathy, maximum or large doses should not be administered for treatment purpose, but they can be administered in cases of primary manifestations of psora, psychosis, and syphilis. Large doses as well as repeated doses of the indicated medicine are to be administered here, otherwise the disease will not be cured, rather go on increasing along its course. Lethal or fatal dose. It is also called as toxological or necrotic dose. It is such amount of dose that can cause death of a living being. The fatal dose of different subjects may vary depend upon their toxicity. A fatal dose of a necrotic or poison will obviously be more than of a stronger necrotic or poison. Minimum lethal dose. Here, it is the smallest dose that can be recorded as fatal to healthy persons. Means also we know that lethal is a toxicological or necrotic dose, and minimum lethal dose means it is the smallest quantity that can be fatal to healthy persons. Next comes booster dose. It is the subsequent dose to enhance the action of the initial dose. Next comes fractional or refractive or dividend dose. It is the fraction of full dose and which can be taken in short intervals. Means a complete dose is divided into number of fractions and was given in short intervals of time. Next comes the physiological dose. Physiological dose are the dose which can stimulate the normal physiology or functions of different organs or system of a body. Hence, thus the symptoms appearing are known as physiological symptoms. Minimum dose. It is the amount of medicine which, though smallest in quantity, produced the least possible excitation of the vital force and yet sufficient to effect the necessary changes in it. What are its characteristics of the minimum dose? It is beneficial to patient, it is curative in action, it is not toxic in nature, and its action has been proved. To remember types of doses, a mnemonic has been created which is helpful to you all. Minimum booster for physiology leads maximum mass. Here, the minimum is for minimum dose, booster for booster dose, 4 is for fractional dose, physiology for physiological dose, lead for lethal dose, maximum for maximum dose, and marks is for minimum lethal dose. What are the disadvantages of using large dose? Point A. Too large a dose of homeopathic medicine is injurious. That is, too strong a disease of medicine, though quite homeopathic, in spite of its remedical nature, will produce an injurious effect by its magnitude. It does much more injury than an equal large doses of allopathy medicine that is unhomeopathic and in no respect adapted to the morbid state. So in that case, the so-called homeopathic aggravation, that is the artificial and similar drug disease called forth in the disease part of the body by excessively large dose, and the reacting vital force will raise to an injurious height. Point B. Produces violent medicinal diseases. Too large doses of an accurately chosen homeopathic medicine, and especially when frequently repeated, bring about much trouble as a rule. They often put the patient in danger of life or make the disease almost incurable. Then, what are the advantages of minimum dose? In order to act really in conformity with nature, the true physician will prescribe his well-selected medicine in minute dose, which is exactly as similar as will just be sufficient to overcome and extinguish the disease. A medicine whose selection has been accurately homeopathic must be all the more salutary. The more the dose is reduced to the degree of the minuteness appropriate for a gentle remedical effect. By applying minimum dose, unwanted aggravation can be avoided. The specific dynamic action which produces uncommon characteristics distinguishing symptoms of the drug is produced by the minimum quantity of drug. The smallness of a dose does not allow the drug to do any organic damage, nor is there any risk of drug addiction and drug effects. To take the full advantage of finer and finest curative property of the remedies, they should be administered in minimum dose. In order to maintain the similarity of the sequence of the disease and the drug, minimum dose is suitable. The concept of minimum dose is verified by Arnschell's law. Small doses stimulate, minimum doses paralyze, and large doses kill. Repetition of doses. It is also called as pharmacoprophylaxis or medicamental repetition. According to 5th edition, aphorism 246, to achieve rapid cure, 3 conditions are to be fulfilled. These are similimum, minimum dose, and repetition. Similimum. It is the medicine selected with utmost care should be perfectly homeopathic. Minimum dose. The medicine should be given in minimum dose so as to produce the least possible excitation of the vital force and yet sufficient to effect the necessary changes in it. Repetition. The minutest yet powerful dose of the best selected medicine should be repeated at suitable intervals. Frequency. Next comes single medicine. It is also called as monopharmacy or singleplex medicine, also called as monopharmacy or simplex. Hahnemann states about single medicine in Organon, aphorism 272, 273 and 274. In aphorism 272, it is given that in no case it is requisite to administer more than single simple medicinal substance at one time. In 273, it was more consistent with nature and more rational to prescribe single simple medicine at one time in a disease. In 274, it is wrong to attempt to employ complex means when simple means suffix. What are the reasons for applying only single simple medicinal substance at a time? The homeopathy medicine was proved singly and the Mitra Medica was built upon the observed effects of the drugs given singly, either in plant proving or in accidental proving. The action of single medicine is certain, but in mixture form it is uncertain. The homeopathy medicine is administered singly so that its action is complete and unmodified by other drugs. If more than one medicine are used, then it is difficult for the physician to assess which of the symptoms are removed by what medicine. It is quite impossible for the physician to select a medicine of a second prescription when more than one medicine is prescribed at a time. Application of polypharmacy for prolonged period in a patient ultimately will develop iatrogenic disease, which is artificial chronic disease or drug disease. In monopharmacy, when medicine does not work or harms, we can change or antidote the medicine, but in polypharmacy, we are not able to know which is acting and which medicine is to be given for the antidote of mixture if any harmful effect is being experienced. In the single medicine is quite enough to remove a disease, either simple or complicated, but it is not possible while several medicines are administered at a time because the mixture of medicines have not been proved on healthy human beings, and as such the symptoms that they can produce in the system is quite unknown to us. So with this, we end the topic Posology. Thank you.